We accommodate in the hospital for people with physical challenges, so why shouldn't we accommodate for people with sensory challenges? CDC suggests that there are probably 1 in 59 births that have autistic spectrum disorder. So that makes about 4,000 children in the surrounding counties. There's a lot of kids in our area.
A lot of times as a mother, you evaluate, is the experience of going to the ER going to be more traumatic to your child than what their current medical emergency is.
They can all have times when sensory input, whether it's light or sounds or touch, can just sort of put them over the edge. And emergency room is probably one of the scariest places they can go.
There's a lot of chaos that's happening, and to someone with autism, they can't turn it off. So they react to that a lot of times. It's a constant anxiety that happens when they're put in this environment, and it's not as simple as saying, it's okay, because to them, that's not going to work. You have to literally change the environment around them.
Sort of consulted with the Sarah Dooley Center for Autism at St. Joseph's Villa and got some suggestions from them. We repainted the rooms into a calming blue color. We replaced the overhead fluorescent lights with LED lights that are on a dimmer. We changed the monitors in the room so that they don't beep in the room. There's not this constant beeping or noise. And just toys that help people with sensory disorders. There are brushes, there are special things that they can fidget with just to make them feel calm. We have Child Life down here, and just to make accommodations even in teaching with the staff on how to deal with someone that has sensory or communication disorders.
Having people who just understand sort of, let me ask if we can do this, or we're gonna do this, and then we're gonna do this. Just explaining it, and having a staff that's trained in speaking to someone who has autism. Matthew is verbal and he can communicate his needs, but there are a lot of kids with autism that cannot. And not having the ability for them to communicate with you is even more difficult.
I just want the parents and the children to be able to have a choice in Central Virginia of where they choose for their health care, and to know that there is a place they can go to feel comfortable and know that their child will be recognized for who they are.
A lot of people think, oh, it's lights, it's something sparkly, it's something that's happening, but to a child that's experiencing this trauma inside their body from their environment, something as simple as that can turn that noise off.
And so understanding how they process information and helping them feel comfortable here gives them a medical home to come to.
It's actually very great.